I'm sure all are very happy.
And here is the very simple, nothing much. Or maybe I didn't get the right one, but anyhow. Right, so if you have read and understood considering its surgical and administration, kindly tell me how would you divide the triangles of the neck?
Yes, the triangle of the neck can be broadly divided into two parts, anterior and posterior triangle.
Can you tell me boundaries of all the interior triangles and their contents?
Yeah. Yes, anterior triangle, it is bounded anteriorly by the median line that extends from the symphysis menti to the suprasternal notch, posteriorly by the anterior border of the sternocleidomastoid. The base is formed above by the inferior border of the mandible, and the angle joining the angle of the mandible, point joining the angle of the mandible and the mastoid process. Inferiorly, the apex is formed by the suprasternal notch, and it is broadly divided into four smaller triangles. The anteriorly, the muscular triangle. In the middle, we have carotid. Above, we have the submandibular triangle, and in really small one, we have the submental triangle.
Okay. Can you please tell me the contents of the anterior triangle as well?
Yes, anterior triangle. In the muscular triangle, there's no important structures, but yes, deep beneath the floor, it lies the thyroid gland, larynx, and the trachea. And the carotid, we have carotid triangle. We have the carotid sheath and its content. Anteriorly lies the ansa cervicalis. Posteriorly, the posterior aspect, we have the sympathetic trunk. And in the submandibular triangle, we have the submandibular gland, lymph node, the facial vein, artery, and the mylohyoid vessels.
Can you tell me how many strap muscles there are?
There are four strap muscles: the mylohyoid, sternohyoid, sternothyroid, and thyroid. The superficial sternothyroid and thyroid.
By which nerve?
The mylohyoid, sternohyoid, and sternothyroid is supplied by the ansa cervicalis from C1 to C3, except for thyroid, which is supplied by the C1 spinal nerve.
Okay, can you tell me about the nerve root of ansa cervicalis?
It is derived from the anterior rami of the cervical 1 to 3.
Okay, how are they divided? Which one is superior root of ansa cervicalis and which one
superior
is
from
root?
C1 and the is from C2 and C3.
Okay. Can you tell me about thyroid gland? How many lobes there are?
Yes, thyroid gland, it lies in the anterior aspect of the neck at the opposite the second, third, fourth tracheal rings. It has two lobes and connected by the isthmus in the middle.
What is the blood supply of thyroid gland?
It is supplied, the artery supply is from the superior thyroid artery, which is derived from the external carotid artery. The inferior thyroid artery from the thyrocervical trunk comes from the first part of subclavian, and some portions also by the artery thyroidema, which is derived from the aortic arch. The venous drainage from the three veins, the superior, middle, and inferior. The superior and middle thyroid vein drain into the internal jugular vein, and the inferior thyroid vein into the left brachiocephalic vein.
And the lymphatic drainage?
Lymphatics, yes, pre-laryngeal, pre-tracheal, paratracheal, and lower deep cervical lymph nodes.
Okay, can you tell me about the embryology of the thyroid gland? How the thyroglossal duct is formed?
Thyroid gland,
Foramen cecum.
Thyroglossal duct is a connection between the foramen cecum and the thyroid gland.
And it passes forward, loops around.
around the hyoid bone.
Yes, then. How would you know if there is incomplete descent of the thyroid gland? How would that present? Lingual or
Present
pyramidal
with-
thyroid? Okay, if there is incomplete closure of the pathway of the descent, then how would the patient present?
Patient might present with cyst, thyroglossal cyst.
Thyroid cyst. Okay, can you tell me the vertebral level of the thyroid cartilage?
Thyroid cartilage, it lies at opposite to C4 vertebra.
Yes. Okay, can you please also tell me how what is the function of recurrent laryngeal nerve?
Recurrent laryngeal nerve, it supplies the muscles of the larynx except for the cricothyroid
Okay,
muscle,
can
which is
you
supplied by the superior
please-
laryngeal nerve.
Yes. Tell me why thyroid moves during deglutition, moves up.
Yes, thyroid, because the thyroid gland, it lies in the pretracheal fascia, which is attached to the thyroid and the thyroid cartilage and the hyoid bone, which and when the mylohyoid muscle moves during deglutition, digastric muscle moves during deglutition, it pulls the hyoid bone and thyroid bone above, also pulling the pretracheal fascia and its content. That's why the thyroid gland also moves.
Okay, what is the most commonly injured nerve during thyroidectomy?
The commonly injured nerves are the recurrent laryngeal nerve, the external laryngeal nerve, the cervical sympathetic chains.
All right. How would cervical sympathetic chain injury would present?
Uh,
Ischemia induced.
ischemia due to the neural damage.
All right. Okay. Can you please tell me what are the types of thyroid carcinoma that you know of?
Yes, we have the papillary, most common, the follicular, anaplastic, medullary carcinoma.
Okay. Which one has hematogenic?
Follicular carcinoma.
Okay. What about the papillary carcinoma?
Papillary spreads
medullary
mostly through
carcinoma?
lymphatic.
Okay. Good. Okay. Can you tell me the complications of thyroidectomy?
Early complications can be hemorrhage, and also the damage to the surrounding structures like the nerves,
Yes.
and the vessels. And the late complication could be hypothyroidism and also hypocalcemia.
All right. Can you tell me the surface anatomy of thyroid gland?
Parotid gland, ma'am?
Yes, please. Have you done that? Okay.
No.
Otherwise, parathyroid glands. How many are they in number?
There are 4, ma'am, 2 on each side.
Yes. Can you tell me about their embryology? How they are?
Yes,
From
yes.
where they are developed?
Inferior parathyroid, it develops from the third branchial pouch, and superior from the fourth branchial pouch.
Okay. How are they? Where are they located? What is their blood supply?
They are located behind the, on the posterior aspect of the lobes of the thyroid gland, and the blood supply is from the inferior thyroid artery mainly.
And lymphatic drainages, venous drainages. I'm sorry, venous.
Inferior thyroid veins.
Okay. Can you tell me, are they both of them are directly in contact with the thyroid, or are they separated?
I think they are separated, ma'am.
Okay. How? Can you tell me?
By the pretracheal fascia.
Are you sure all of them are enclosed with pretracheal fascia with thyroid? Or
I'm not sure, ma'am.
Can Dr. Kuldeep, you tell me?
Sorry, ma'am.
Can you?
Ma'am, can you repeat the question, ma'am, again, please?
Relation of parathyroid glands and thyroid. Are they in direct contact, or are they separated?
Yeah, they are in the direct contact. They are present in the posterior aspect of the thyroid gland, present in the thyroid lobe, superior, 2 in each lobe, ma'am.
What is their relation to pretracheal fascia?
They are present posterior to the pretracheal fascia. No, sorry, interior to the pretracheal fascia. Sorry. Interior to the pretracheal fascia.
Sure.
Yeah.